Thank you, Mr. Chairman. Commander Metcalf Foster, thank you for your service, your leadership now, and through you to your members. I think of David Garcia in El Paso, one of your leaders there who comes to every single one of our town hall meetings and very often is the lead advocate in the community on a veterans issue that I may not have been aware of, but that we then make our priority because of the urgency that he brings to the issue at town hall meetings like that. And I know that's true for all of my colleagues in their congressional districts as well. I want to thank you for making one of the legislative priorities improving access to timely mental health care help. I've learned from listening to my veterans and their family members that care delayed becomes care denied, and is absolutely connected to the fact that today 20 veterans will take their own lives. It'll happen every single day until we meet this crisis with the urgency that it demands. And so I want to follow your lead on the legislative request. I'm also grateful for your support for Secretary Shulkin, who is the first VA secretary to make suicide reduction his #1 clinical priority. That will result in more lives saved. And lastly, I'd like to get your thoughts on, or through you, somebody on your team, a bill that I have worked on with Representative Kaufman to help a specific group of veterans, those who have an other than honorable discharge, bad paper discharge, who right now are effectively precluded by law from being able to see a psychiatrist or psychologist, though tens of thousands of them, going back to the Korea era up through current combat, have been diagnosed with post-traumatic stress disorder or traumatic brain injury while in service to this country and cannot get in and see a provider, and they are killing themselves at twice the rate of the general veterans population. We were able to pass a bill that will open up mental health care to those veterans. There's a bill pending in the Senate, and I know I've got colleagues here on the dais from the Senate. It's rare that we get to meet together. I would urge them to work on this issue with us. But I'd love to get the DAV's perspective on this issue of expanding mental health care access to veterans with bad paper discharges.
At DAV's last national convention last year, we did pass a resolution. Our membership approved a resolution that does support making sure that veterans with a less than honorable discharge do have access to mental health services. We recognize that TBI, post-traumatic stress, other conditions that are related, we know, to military service that may have gone undiagnosed at the time have contributed perhaps to that discharge. And we think it is essential, given the Secretary's, I guess everyone's responsibility, looking to VA to be the person, the organization that's going to make sure that we start to reduce this suicide among this population. And those efforts that, his expansion of that right away was, I think, a critical piece in trying to get those people who have not had access to VA health care. And DAV has been supportive of ensuring that veterans who need VA health care have access to it.
Thank you. And I want to thank you personally and Gary and others who worked with us. As you know, we faced a real crisis in El Paso. Out of 141 mental health care service centers in the VA, we were ranked 141st for wait times. We were losing veterans because they could not get in. We estimate in El Paso 37% of veterans were not able to make a mental health care appointment who tried to make a mental health care appointment. And all too often I was meeting with their widows or their surviving children after that veteran had taken his own life. You have helped us to go from 68 full-time mental health care providers in El Paso. Today we have 112. More veterans are getting in. There are more appointments open to them. We're turning this around, and I won't be satisfied until we're the best in the country. But the case that you made by focusing VA hiring on primary care providers, on mental health care providers at a time that we have 30,000 by the Secretary's own admission, 30,000 funded but unfilled clinical positions in the VA. If we can get that done through your all's leadership, I think we're going to be saving more lives and more veterans in this country. So I want to thank you, and any help you can provide in helping our colleagues in the Senate to get the House-passed version or some version of this passed so that we can get it on the President's desk and open up care to veterans who have an other than honorable discharge. Thank you, and Commander, thank you for your help. I yield back to the Chairman.